Insights from more than 700 financial mentors across the country paint a picture of the rising number of working poor. The FinCap report shows an 88% increase over 4 years in financial mentor clients who are in work but struggling with the cost of living. As political correspondent Zane Small reports, buy now, pay later debts are on the rise and becoming an indicator of financial hardship.
Chris Martin, Claire January and Brian Clee, financial mentors at the charitable trust Supergrands based in Lower Hutt. Their insights helped form FinCap's latest Voices report that exposes the growing demand for financial assistance.
In the last 12 months we've worked with 580 families, actually 583 to be exact, and that's about a 500 to 600% increase from the previous year.
The report says the increased cost of living made up 29% of all recorded reasons for hardship in 2024, followed by health issues, decreased income, unexpected costs, owing money to wins and job loss. It also notes that the percentage increases in wages and salaries only just matched increases in living costs for 2024, and for some households, cost increases continued to outpace income increases.
The income support people do receive is increasingly insufficient and is leading to buy now, pay later debt and debt to government. And 1 in 8 clients sought KiwiSaver hardship withdrawals last year.
And what's particularly concerning to financial mentors is the financial difficulty of those who are in paid work but are increasingly presenting for support due to the cost of living. And it's coinciding with a rise in buy now, pay later debt, which is becoming an indicator of financial hardship. Afterpay, for example, allows customers to purchase and take home an item and pay for it in 4 payments over 6 weeks, interest-free. However, missed payments incur a fee of up to 25%. A spokesperson told us 96% of all purchases with Afterpay incur no late fees, and the service is suspended if a customer misses a payment. But the FinCap report says buy now, pay later debts doubled as a percentage of debts over the past 4 years.
Got people that are losing their jobs, that had hard jobs, they're trying to pay mortgages, pay off cars, feed their children. Others that just don't have enough money.
One of the hardest areas at the moment is the people that are borrowing money to borrow for cars.
The report was released at the Beehive today, attended by Consumer Affairs Minister Scott Simpson.
The reality is that for many New Zealanders, they're doing it tough. And they're doing it tough for a whole range of reasons.
The opposition blaming the government.
An advocate in Taranaki has said, quote, "We've been feeding, clothing and checking in on our whānau for 10 months and the numbers have doubled." Unquote.
The member highlights that there are people doing it tough because New Zealand has gone through a prolonged cost of living crisis and has endured a recession created by the profligate fiscal mismanagement of the last government.
Regardless of who's to blame, the struggle is real. Just ask this trio.
The demand for things like food parcels. This month we've had 53 referrals. We used to get about 10 to 12.
3 financial mentors sounding the alarm about the growing ranks of working poor.
And Zane, nurses went on strike yesterday wanting a better offer from the government. Is there any update there?
Well, I just heard from the Nurses Union, and at this stage no further meetings have been set up. The Chief Executive, Paul Golter, told me we want to negotiate a settlement that meets the needs of both parties, so the deadlock continues for 36,000 nurses. Health New Zealand said despite heavy winter occupancy, the hospitals got through the strike action yesterday without any major incidents. And as the employer, Health NZ, said, it is committed to settling the collective agreement with the union. Now, there was some good news for the government tonight, with the union representing midwives accepting their latest offer from Health New Zealand. It's over 29 months and includes a 3.5% salary increase.